Hello, and welcome to our first episode of the AADI video series, Let's Talk About. I hope we all had a chance to enjoy the warm summer weather. Here in Boston, the leaves are changing color and mornings are cooler. In this video series, we hope to talk about many topics we are all wondering about. Living with diabetes, how we can take care of ourselves, day-to-day stress about uncertainties, and much more. On today's episode, we want to talk about physical and emotional stress. Stress can affect many different aspects of our lives. And for those living with diabetes, it can cause their blood glucose to increase. Being diagnosed or managing diabetes can be stressful. These are the topics we'll be covering. We hope today's webinar will be helpful to you. For those who are not familiar with me, I am Julia Lee from the Asian Clinic here at Joslin Diabetes Center in Boston. The Asian Clinic was founded in 2004 tailoring Joslin's patient care and education specifically to our Asian population. We are also passionate about sharing what we learn and do with the rest of the Asian communities. I am the Asian Clinic Coordinator helping you with appointment scheduling. I serve as a liaison between patients and providers. I also help find out when your medication is not covered by the insurance. I can speak Chinese, Cantonese, and Mandarin, and sometimes patients find it more comforting when they can speak in their first preferred language to me. If any of you who are interested in coming to Joslin's Asian Clinic, I will be the one you can reach out to and help every step of the way. Today, I'm excited to welcome Dr. Persis Commissariat, a clinical psychologist here at Joslin Diabetes Center. As we dive into today's first episode of the series, I will be asking her questions and concerns that patients may have. Thank you so much for joining us today, Persis. Can you please tell us a bit about yourself?
Sure. So as Julia said, my name is Persis Commissariat. I'm a clinical psychologist and a certified diabetes care and education specialist here at the Joslin. I actually work in the pediatric clinic and I see children, teenagers, young adults living with diabetes as well as their families. And I've also lived with type 1 diabetes for over 20 years. So I'm very familiar with many of the day-to-day challenges that come with it.
That's great that you're so familiar with diabetes. Can you tell us a bit about your role at Joslin and the challenges of diabetes that you mentioned?
I would actually like to think of my role as just trying to make diabetes easier, because as we all know, diabetes is not easy. On any given day, there are dozens of things that you have to do to manage your blood sugar. We always think of taking insulin and counting carbohydrates and checking blood sugars, but there's often so much more to it than that. There's the work you do to plan for diabetes so that it doesn't get in your way. There's the work you do to manage and use any devices that you may wear, like an insulin pump or a CGM. And there's work that you do to interact with the people in your life that help you manage diabetes, as well as all of the things you have to do to manage the people who can sometimes make you feel bad about having diabetes. Plus, there's just the day-to-day of trying to make diabetes fit into all the other things you have to do in your life, like school or work or just taking care of your family. And you have to do all of that work with the knowledge that sometimes diabetes has a mind of its own and nothing's going to work out perfectly despite all the effort you put in. And oftentimes that can lead to a lot of stress, a lot of burden, and sometimes even ignoring diabetes to the point that it leads to some depression and anxiety. So my role in clinic is really to help people through all those phases so that you can fit diabetes into your life with as little burden and stress as possible.
I think that makes so much sense. Diabetes is a lot, and it certainly isn't easy to manage. For the Asian Clinic, I process all the intake for new patient referrals. Some patients are newly diagnosed. Some are feeling shocked when they're told they have diabetes. When you have diabetes, sometimes you can have multiple appointments with a doctor, dietitian, or exercise physiologist. It will involve making time to come for these appointments, keeping track of their blood sugar, being mindful of what to eat, and taking medications on time. Persis, what would you recommend to those who are feeling overwhelmed when they're told all of this could be their life from now on?
Well, let me first start by saying that it's totally okay to feel overwhelmed because this is a lot to take on. But like many challenges, it does get easier over time. And before anyone rolls their eyes at me, I know how cheesy that sounds, but diabetes is long-term, unfortunately. And because it's long-term, managing it is a process. So you have to learn the skills that you need, but once you learn them, you learn the skills and the practices and the treatments and how to make diabetes fit into your life and not the other way around. It becomes less overwhelming and more routine, more like an everyday task. So then that terrible feeling doesn't last forever. It just takes a lot of extra work in the beginning to adjust. I actually tell all my patients that diabetes doesn't have to ruin your life and it doesn't have to hold you back. And that can be really hard for people to wrap their head around sometimes, just given the vast amount of work that diabetes entails. So I always have to tell them, like, remember, it's your diabetes. It's yours. You own it and it belongs to you, which means you are the one in charge here. You don't have to make diabetes your priority, and you just have to make it a priority. It doesn't have to be the only one, and it has to fit in with all the other things that are important to you in your life.
Can you tell us more about what it means to fit diabetes into their life? It almost seems like people have no choice but to fit diabetes in because of all the things that can happen if they don't treat their blood sugar levels.
That's a great question, and you're absolutely right. It is like you have no choice. So when I talk about fitting diabetes into your life, it means that diabetes itself and management becomes a routine part of your life. Like, it doesn't have to feel like a massive burden that you have to hide or that you have to ignore. Having diabetes feels like just another part of who you are, and managing it is just another part of your everyday routine, something that you have to do to feel your best. Now, it sounds like a nice, pretty picture that I paint, and it's not to say that diabetes isn't really annoying and really difficult at times. Things still go wrong. But if diabetes can fit into your identity and your daily routine, then there's less negativity and more positive engagement with diabetes care, even when things do go wrong, because you spend most time feeling neutral about it.
It sounds like that's a healthier and less stressful mindset to take. What are some things people can do or change in order to fit diabetes into their lives?
The way that a person can fit diabetes into their life is actually probably very specific to each person, but maybe I can paint a picture here. So let's consider that in type 1 diabetes, for example, you have to take insulin before you eat. And that can be really hard to do. I say that from personal experience, spent many years like this. It can be really difficult sometimes to take insulin before food, because what if you don't know the carbs in your meal ahead of time? What if you're taking injections and you want a private space to do it, but you're eating with other people? What if you're worried that the people around you, anyone you're eating with, is going to judge you for having diabetes? Or what if you're out with other people and you don't want to make them wait 15 minutes because you had to wait 15 minutes for your insulin to kick in? And probably the most common burden is, what if you're just really hungry and you just want to eat? You don't want to wait 15 minutes. You don't want to take an injection. You just want to eat the hot food in front of you. So I'll tell you, as a person with diabetes, I have often told my patients, I feel like it's cruel and unusual punishment to have to sit there and wait for your insulin to work while the food's waiting for you. So with a burden like that, something you have to do for every piece of food you put in your mouth, it can be really hard to fit something that frustrating into your life. So my advice in trying to fit it in is you experiment with what tools you have available. So maybe you can look up carbs ahead of time, or ask whoever is cooking what they plan to make so that you can guess, you have an approximation on carbs. Or maybe if you're at a restaurant, take your insulin as soon as you order your food, and then keep a drink with some sugar or a couple glucose tabs nearby, just in case like your meal takes a very long time to come out. And if you're at home, you can ask your family or your friends to remind you to take your insulin maybe 10, 15 minutes before the food is served. And if your meals are at the same time each day, for example, you can always set a reminder or an alarm to take your insulin. If you wear a pump, there's a feature in all pumps called a missed bolus reminder. Maybe you can have that go off, because then your pump will tell you, hey, you haven't taken a bolus in this time frame, maybe you should. Or in fact, even beyond some behavioral changes, you can go and talk to your doctor about maybe a faster acting insulin might be an option for you. And that way you don't have to wait. There are some new insulins out there where you can take them as soon as you start eating. So perhaps that could be an option. There are just so many different things that you can experiment with. And depending on your own personal comfort level or where you are in any given situation or what exactly you're struggling with, you can find different ways to fit those mealtime boluses into your life using one of these options that are available to you. You don't need to change what you're eating. You don't need to change how often you eat, unless, of course, that's something your doctor has suggested. But instead, you make diabetes work in the life that you already lead and the life that you want to lead, and you find ways to fit it in using what's available to you.
Those are great tips. Thank you. I noticed earlier you said, what if you're worried the people around you will judge you for having diabetes? I'm grateful you brought this up because I hear it often. There seems to be a lot of shame around diabetes among the Asian community, which also affects who they tell and how they manage their diabetes. What advice do you have for people who are struggling to fit diabetes into their life because of that embarrassment or fear?
That's a good question. I know that feeling. As a professional, I would want people to know that there's nothing wrong with them and they have nothing to be embarrassed about. And anyone who judges them needs to be better educated on diabetes. But as a person with diabetes, I can also admit that it has been very hard in the past to feel comfortable and confident with diabetes, especially around other people, because you don't know how they'll react. One really helpful thing that I've learned over the years is that how you respond to your diabetes is how others will respond to it. And research has shown in general that people who are able to share their diabetes with others, to just disclose that they have it, they tend to get more support and they have better overall health because support helps. So if you get really secretive when it's time to eat, or you tell people, mind your own business when they ask you questions, it leads other people to think that diabetes is a shameful thing. So there are many people who just completely ignore their diabetes in social situations, and then their blood sugar ends up going very high or very low, and then they act out because they don't feel well, and that brings on some judgment too. But I often tell people, if you can maybe casually mention diabetes in conversation, if you can make jokes about it, or even if you can just check your blood sugar or take your insulin in front of others, even without saying things, you can change people's perspective. It's like passively disclosing that you have diabetes because you're making it seem neutral. You're not making it seem shameful. You don't have to lie and say it's a great, exciting thing. It's just there. It's annoying, but it's manageable. And therefore, there's nothing left to judge there. And you let people see just really how impressive you are by living a happy, healthy, productive life while you manage your diabetes.
That's really good advice. Thank you. What would you suggest people do when their life situations change, though? I hear from many patients that diabetes care becomes much harder when they have changes to their lives, like starting a new job or school, because it's like starting over again. They have to manage their diabetes in a new place and with new people around them.
Yes, you're absolutely right. And sometimes you have to change up the way that you share and the way you manage diabetes when your life circumstances change, or when the people around you change, or even just when your treatment regimen changes, when you change from pills to insulin or injections to a pump, it can be very annoying to have to change a routine, because I've been presenting this to all of you as it's routine. It's something you do every day. It's part of your daily schedule, which means once you reach that point, you're probably comfortable with the way things are. So it is super annoying to have to change again. But I hope people will also remember what I said before about you fit diabetes into your life, not the other way around. So if you have to fit diabetes in, that means that if your life changes, the way diabetes fits might have to change too. And you'll get used to that, just like you did the last time. Again, annoying, but manageable. And adjusting diabetes to your new situation is not to add burden, it's to avoid it. You do it now so that you don't have to struggle with it later.
That's true. It seems like it's more work in the beginning, but it saves you a lot of stress in the long run. Thinking about fitting both diabetes care tasks into daily life, as well as sharing with other people, what would you suggest if people don't know what to do or what to change to better fit diabetes?
Oh, this is an easy question. It's reach out. So I'm sure everyone has people in their lives that want them to be healthy, and maybe those people will want to be more involved. Maybe they'll have suggestions. That super common phrase, no man is an island? It applies here too. Diabetes affects the whole person. And in doing so, it affects your daily life, it affects your health, and it affects all of your relationships, because this is just, it's part of your day-to-day, right? It has to. So if it's going to affect your relationships, let other people help. And most importantly, reach out to your diabetes care team, because I think I can safely speak for all providers when I say they prefer that you reach out with questions rather than holding on to them and struggling. It is absolutely not a burden for any provider to hear from a patient, and it makes the care that you receive even better, because we're able to address concerns and issues before they turn into big barriers for you. And in fact, I don't know if you were aware, Julia, but our behavioral health team at Joslin is fantastic. In fact, the American Diabetes Association recommends that mental and behavioral health are standard parts of diabetes care, as in all clinics need to consider the emotional impact of diabetes and have providers who are available to help. And Joslin has that. So ask to see one of us. We would love to meet with anyone in your clinic.
That's great that you mentioned help, because I want to ask you more about that. You mentioned how everyone has people in their life who wish for them to be healthy, and they might be more involved. What if the patient support system, such as a parent, spouse, partner, or friends, want to support them as much as possible, but it doesn't seem to be effective? I hear from both patients and families how frustrating it is when families try to help and patients get upset or even turn them away.
That's a great question. I think it can be really tricky for support systems to offer the right type of help. And it's hard for the person with diabetes to accept help from others without feeling burdened by it. I actually also hear this from many families and people with diabetes, that they have others in their life, family and friends, who worry about them. And that worry causes their family and friends to become annoying. They start nagging, they micromanage, they make these judgmental comments or remind the person of complications that could happen. And of course, the one that I hear the most often is that classic hated comment of, can you eat that? And it's really distressing for a person with diabetes to feel like someone is always on top of them. So there's actually a term for these interactions, it's called miscarried helping. So what it means is that a family member is trying the best they can to help you manage diabetes and help you understand how serious it is, but it can leave the person with diabetes feeling a lot of blame. Like no one recognizes that they have priorities and desires besides managing diabetes, and that they were probably doing the best that they could in that moment. But then they got hit with all this shame and judgment. So I think what's really necessary for everyone to understand is that actions are not considered help unless they are helpful to the person receiving them. I'm saying that really slowly so that everyone understands, because I think this is super important. Everyone perceives help differently, and your support system needs to understand that the person they are attempting to help is the one who gets to decide what is useful or not useful to them. I often tell people in my clinic, the best way to get the type of help that you need is to ask for it. Like just lay it all out there. For example, most people, they don't want to hear about complications. They don't want to hear the dreaded, like, you need to take care of your blood sugar, or you may have your foot cut off. Who would want to hear that? That sounds terrible. Maybe they just need you to listen when they say that they're really frustrated with diabetes and don't want to deal with it. Some people may not want to have big discussions about diabetes. Maybe they just want you to act supportive. Maybe they want you to attend visits and learn with them. There are others who may appreciate a more active role. Maybe they'll want reminders to check their blood sugar or take their medication, but maybe they want to change the way in which they are reminded because it makes them feel badly. You know, they don't want to hear, "Ah, did you take your insulin?" Maybe they want to hear, "Hey, don't forget to take your insulin," because tone is everything, right? I would actually encourage families and friends of people with diabetes to directly ask, how can I help you better? And I would encourage people with diabetes to just be really honest about what works for them, and it'll allow everybody to be on the same page and work better together.
I do hear that a lot of people are nervous about seeing any mental health provider because there is a stigma among Asian Americans that you're quote unquote crazy or being viewed as weak for seeking help in mental health care. Have you heard of this before from patients?
I've definitely heard this before too. And mental health care is a pretty broad field. So there are certainly mental health professionals out there who treat some very serious and severe issues. I think in the case of diabetes, though, the reason that we're here is because diabetes affects so many aspects of your life. It affects you and your identity, your relationships, your work, your everyday activities. It just hits every part of you. And we know that diabetes is both physical and emotional, and getting the support you need from a professional doesn't mean that you're crazy. There's nothing shaming about getting support. Seeing a professional just means that diabetes is hard and you are using every tool available to you to manage it. Because if it's going to affect all parts of your life, why wouldn't we treat it from every possible angle too? Your mental health is still health, and we want all parts of you to be healthy.
That's great. Thank you. That brings a wrap to our first AADI video series, Let's Talk About. We hope that the topics we discussed today will give everyone some reassurance on how we can handle the physical and emotional stress from diabetes. We have created a list of helpful information for you to view or download on our website. Please take a look and share with anyone who may find it useful. If you are an Asian Clinic patient, you will be getting this information in your patient folder. If you have any questions to Persis or Joslin's Asian Clinic, please feel free to contact me. We are planning to create a series of videos like today's. If there are any topics you're interested in hearing about, please send me your suggestions to the AADI email. Persis, thank you so much for joining us today. Stay tuned and we will see you in our next video series, Let's Talk About Physical and Emotional Stress with COVID-19 and Anti-Asian Hate Crimes. Stay safe and well.